Meet Monica. She has chest pain. Today, for Health Connect Essentials, we are going to document her encounter with her doctor. Okay, so let's get started. Please select your patient and document along. I will be Dr. C, and Monica will be herself. Hello, Miss Monica. My name is Dr. C. Nice to meet you. Sorry for the long wait. What brings you into the emergency room, and how can I be of use to you?
Nice to meet you, Dr. C. I started having chest pain last evening. It is located in the center of the chest. I'd say it started as mild, but as time has gone on, it has been more moderate. It's constant. It's a burning type pain that radiates to my left arm and back. It's worse with eating and laying down. It's associated with some nausea and shortness of breath. It kept me from sleeping last night. It feels better now, however, after having waited so long.
Okay, I have your history. And yes, some people think that our waiting room can be very therapeutic. After going over your chart, let me just summarize your past medical history. Your primary doctor is Dr. Primary. Your past medical history is hypertension, diabetes, and high cholesterol. The meds you take are metformin, hydrochlorothiazide, metoprolol, and lovastatin. You have allergies to amoxicillin, which causes a rash. You quit smoking 10 years ago, don't do any illicit drugs, don't really drink on a regular basis. You have a family history of diabetes, but as far as I can tell, you have no family history of heart disease. Is that correct?
Yes, that's all correct. That Dr. Primary, he is such a good doctor.
Yeah, that Dr. Primary. I've heard nothing but good things about him. Anyways, a little more about your chest pain. Is it sharp in nature? Is it worse when you take a deep breath? If you had any recent surgeries, if you've been on any long trips like plane rides or even long car rides, have you had any leg pain or leg swelling, especially in one leg? And finally, does anybody in your family have any history of having any type of blood disorders or blood clots? Do you take any oral contraceptives?
No to all of the above.
Okay, got it. If you don't mind right now, I'm going to do a quick physical exam. I'll take a listen to your lungs and your heart, take a look at your legs. While I'm doing that, I hope you don't mind if I just ask you some general questions about your overall health. Have you had any fevers, rash? Have you had headaches? Any blurred vision? Have you been coughing? Have you had any abdominal pain? Any vomiting? Have you had any urinary problems like burning or frequency? Do you have general muscle aches? Do you feel like you bruise easy? And lastly, have you been feeling dizzy at all?
No to all of the above, except for this rash on my left elbow. My husband says it's due to syphilis.
Well, knowing your husband, I'm sure he has his reasons why he might think it's syphilis. Anyways, the rash I'm not very concerned about, at least from an emergency perspective. I'll have you follow up with the wonderful Dr. Primer regarding that. Regarding your chest pain, everything looks normal. Your exam is completely normal. Your EKG looks normal. We got a chest x-ray that looks completely normal. And all the lab tests that we run, even liver functions and lipase, have all come back completely normal. So that's good news. I think your pain, although it's in the chest, is atypical for any kind of serious chest pain that we worry about here in the emergency room. What I do think it's probably due to something called reflux, where there's too much acid in the stomach and acid comes up and burns the esophagus. I'm going to leave you a prescription for some medicines that I think should help. I'll give you some instructions regarding reflux. You shouldn't eat too much at a time. You should sleep with the pillows propped up. And I'm going to start you on some antacids, which might help you. I will get you some close follow-up with your regular doctor.
So I'm glad you think the pain is not due to my heart. Thank you so much. When can I leave here? And can I get a note for work?
Of course, you can get a work note, and we'll have you out of here within the next 15 to 20 minutes. I just need to tell the nurse to print out all your discharge instructions and make sure you get a follow up booked within a week. Before you go, Miss Monica, we need to discuss some things. I told you earlier that your labs were normal. I meant your cardiac and your liver labs were normal. You actually did have a couple abnormalities. Number one, your blood sugar or your blood glucose was 173, so a little bit on the high side. Number two, your creatinine, which is basically a marker of your kidney function, is a little elevated, meaning that they don't work as well. It went from 1.4 to 1.9. Both these things you will need to follow up with your doctor primary with. Lastly, your blood pressure has been a little high. The last reading here was 152/90. There's nothing that we need to do about this acutely, as anybody that comes through the emergency room, their blood pressure is actually a little elevated just from the stress of things. But you will need to follow up with Dr. Primary regarding this. Okay, Ms. Monica, here are your diagnosis in checklist format. Number one, acute gastritis, meaning inflammation around the stomach and esophagus, from probably number two, gastroesophageal reflux disease, which we talked about earlier. Number three is hyperglycemia, which means slightly elevated blood sugar. Number four, high blood pressure or hypertension. Number five, acute kidney injury due to hypertension and diabetes. And number six, rash. Most of these things will have you follow up in a week. Thank you for allowing me to care for you today.